my wellness segment. The Wellness Watch. And I actually have like 2 stories from my Wellness Watch, y'all. So, if you have been up under a rock and don't know what's really going on, the Wellness Watch is where we slow things down for a moment and talk about the health stories impacting the world around us. Tonight, we need to talk about something that's quietly been escalating overseas, and that's the growing Ebola crisis in Central Africa. Right now, health officials are closely monitoring an Ebola outbreak spreading through parts of the Democratic Republic of Congo and Uganda. And the situation has become more serious enough that the World Health Organization, the WHO, the WHO, has declared it an international public health emergency. Now, if hearing the word Ebola sounds alarming, it's because historically this virus can be extremely deadly. It spreads through direct contact with bodily fluids from someone who is infected and showing symptoms, not through the air like COVID. Early symptoms can look like the flu, fever, body aches, weakness, vomiting, and severe stomach issues. In more serious cases, internal and external bleeding can happen. What makes this outbreak different this time is that experts say that this is a rare strain called Bundibugyo Ebola. And unlike some previous outbreaks, there is no approved vaccine currently available for this version of the virus. Health teams are racing to contain it through contract tracing and treatment centers and travel screening. Here's an update. So I tried to get updates before I came on live. As of this week, hundreds of suspected cases have been reported, with deaths continuing to rise in affected regions. Officials say crowded hospitals, regional conflict, and misinformation are making containment more difficult. Here in the U.S., the CDC says the risk to the general public remains very low, but enhanced airport screenings have been expanded for travelers arriving from impacted areas. So let me, and then I will say, and doing my research on this as well, there have been some conflict over there in the Republic of Congo and Uganda. They are burning down these tents that are doing the Ebola screening, because unfortunately, after their loved ones have been deceased, have died, they're not releasing their bodies right away. And so the people are mad that they're not releasing their bodies, and they are burning down these tents, these treatment centers for these people. So let me pull up the latest details on that, and then we'll move on. I got one more thing as well for this segment that seems, put your radar up. So let's see. Oh, that's loud, y'all. Let me add this.
The Ebola outbreak in Central Africa. 3 Red Cross volunteers now among the newly reported cases. And with the World Cup less than 3 weeks away, what health officials here in the U.S. are doing to screen travelers from overseas. Here's ABC's Marcus Moore.
Tonight, as a deadly Ebola outbreak ravages parts of the Congo, the International Red Cross says 3 of its volunteers are among the new reported cases. The agency says they were infected in March, weeks before the latest outbreak was discovered, and they are among the first known cases. Now, there are nearly 750 suspected cases in the Democratic Republic of the Congo, including 176 deaths, and a number of infections reported in neighboring Uganda, including a death. As they try to stop the spread of the virus, health officials are facing numerous challenges in the region.
We are operating in a very complex environment, and the main challenges include community fears, misinformation, and rumors. Another challenge is that the population movement between health zones.
That misinformation part of the growing anger and frustration among the public. Last week, friends of some of the outbreak's victims setting a medical tent ablaze in the eastern part of the country, according to doctors there. A second medical tent set on fire last night, according to health officials. The Associated Press reporting at least 18 people with suspected Ebola ran from those tents where they were receiving treatment. It comes as health officials implement new measures to prevent the spread of the virus in the U.S. U.S. citizens who've been to impacted countries in the region are now funneled to airports in Virginia and Atlanta for temperature checks and health screenings. No foreign visitors from the region are allowed, including U.S. green card holders.
Our number one thing has to be, we can't have it affect the United States. We can't have Ebola cases coming here.
All of this is unfolding as the U.S. prepares to host the FIFA World Cup. The DRC's team, set for its first berth in 52 years, is expected to arrive in just a few weeks. The White House demanding that the team maintain a bubble in Europe where they are now for 21 days, or risk being banned from entering the U.S. And tonight, Reuters reports that a team spokesperson has said that they are not changing their schedule.
And with that spokesperson, according to Reuters, is suggesting that the schedule isn't changing because their players are not traveling to the U.S. from the Congo. Meanwhile, doctors there say misinformation in the country and stigma surrounding the disease are creating a dynamic and complex situation.
Yeah, so that's tough, y'all. You see where they were burning down the treatment tents? Let me see if I got one more video related to this. Hold on one second. Let's see. I thought I did, but I might not. I'll be adding so many videos to this, y'all. I don't know if they'll copyright me on that one, though. Hold on, let me see. I think this is Jerika's. Is this from the night? Yeah, this says 22 hours ago. What was this one? Hold on. That's the updated. So that's the updated one that I played y'all the first time. So that was the updated one. So Tristan said Ebola again. Dang, yes, Ebola again. It's resurfacing. I guess the Hansa virus wasn't enough to scare us. So Miles said, yeah, Tristan, they're experimenting on Africans again. Right. This is not, Tristan said, right, this is not a coincidence that it's happening in Africa. Yeah. Yeah. So I have one more story for the wellness check. And let me see if I got it. Where did it go? I've had it. Hold on. Yeah, I gotta look it up. But I thought it was I thought it was crazy because we go to the dentist office to get our teeth cleaned and maintained, and our oral health, make sure it's nice and rolling. And when I run across this, there it goes right there. There we go. Let me run this back and pause it. Hold on. So we're going to listen to this. Actually, let me tell y'all about it first. Hold on. So let's see, where is it at? So this is another health story that caught my attention this week, and honestly, it's one that could make a lot of people uncomfortable, right? So health officials in Philadelphia are urging hundreds of patients to get tested for HIV and hepatitis after investigators say a dental clinic may have exposed patients to a contaminated equipment and unsafe sanitation practices. Officials say concern centers around a clinic called Smiles at Rittenhouse Square, where allegations include improper sterilization and the possible reuse of medical supplies intended for single use. Now, officials stress that the risk is believed to be low, and there are currently no confirmed HIV cases linked to the office. But because blood-borne illnesses can take time to show up, we all know that, patients who visited over the last year are being encouraged to get tested out of caution. What y'all think about that? Let's pull this up, and we're gonna listen in on what they got to say.
To the dentist recently, now have to worry about whether they were exposed to HIV and hepatitis. The health department says the possible exposure was at Smiles at Rittenhouse Square in Center City. And tonight, the practice is closed and patients are being urged to get tested. Action News reporter Walter Perez live in Center City with those details tonight. Walter.
And Rick, health officials are contacting patients from Smiles at Rittenhouse Square who went to the clinic between April of last year until the present day. The reason is what health officials are describing as possible exposure to serious illnesses and viruses, including, as you mentioned, HIV. The investigation is ongoing, but Dr. Kirti Chopra's license to practice dentistry has already been suspended temporarily, and her practice, Smiles at Rittenhouse Square, has been shut down. And it all started after the state health department contacted the Philadelphia Department of Public Health.
They had received a complaint about this dentist and conducted an investigation. Our team went out with them to conduct an on-site visit to document the practices at the dentist office.
The ensuing inspection order goes into full detail about the findings. Those orders state that Dr. Chopra occasionally set aside used single-use anesthetic vials for reuse, and that she does not replace saline bags used for implant procedures until the bags are empty, just to name two.
It ends up being a lot of possibility of transfer of bodily fluids between patients.
Health officials say even though the risk of exposure is low, Dr. Chopra's patients are being encouraged to test for exposure to hepatitis C, hepatitis B, and HIV. An attorney representing the practice sent Action News a statement reading in part, quote, Dr. Chopra will continue working cooperatively with public health officials regarding patient notification, testing recommendations, and any required infection control remediation. We spoke with people who live in this part of Center City who say this is not something you'd expect when going to the dentist.
I am a little surprised because you would trust a medical professional.
Rule of thumb, I would assume that any dentist I go to uses the proper sanitation techniques. So that's pretty, absurd.
A preliminary hearing is scheduled for next month. In the meantime, more information, including a patient hotline, can be found on 6ABC.
Well, yeah, y'all. That's wild right there. Wouldn't expect going to the dentist office to be exposed to HIV, let alone anything else. So this is just a reminder that asking questions about your healthcare is okay, whether it's a doctor's office, dentist, or clinic. Your health matters and your safety should never be optional. It's wild. If y'all are catching this on a rewatch, make sure you like, comment, I talk back, and make sure you hit that subscribe button. Turn on those notifications so you don't miss me when I go live. In Too Deep is in here. Trisha said, I'm ready to hear what their excuses are this time around with Ebola. Yeah. Hey, In Too Deep, how are you doing? Welcome in, welcome in. They've been getting acquainted back and forth. Trisha said he just got off work. He's just chilling. In Too Deep in here, putting in work already. Yes, y'all, I have. I am not fully monetized yet. I'm not monetized yet at all. I'm working towards that. So make sure you hit that subscribe button. I do have my Cash App open as well if you would like to donate to make sure that I keep bringing you this great content. My Cash App is Soft Rain, RSCREIGN. Thank you, In Too Deep, for putting that out there. Miles says Smiles is a franchise, locations across the country. Yeah, but why are you reusing things that are meant to be used one time? Instruments that are meant to be used one time. And In Too Deep said, welcome in to the newbies. As you come in, please click the like button and hit subscribe. It's a free way to support the channel. Yes, and if they charge you, let me know. We'll do some investigation on that. See how we can help y'all get that situated. In Too Deep said malpractice insurance is going to cover this. Miles said that's insane. Were they sharing toothbrushes? No, they were sharing or they were reusing medical instruments that were meant to be used only one time. That's what was happening. Tristan said, imagine going to the dentist to improve your smile and you leave with a whole STD. Hey, Tez, welcome in, Tez. I appreciate you being here. Tristan said, do they not clean their tools or replace them? Supposedly, Tristan, they were one-time use. Tez said, yes, let's get rain money. Yes, we made it over to 200 mark on the subscribers. I have 208. 206, something like that. So I appreciate everybody that's been here from the ground up since I've been building this. We getting there. It's coming. It's coming. Those watch hours are going up. It's gonna take a little bit longer to get those watch hours up, but that's the reason why I'm here, y'all, to bring y'all some good content and to keep it moving, keep it moving. And Too Deep said malpractice insurance cost. Let's try this again. Malpractice insurance costs span a wide range from under $100 a year for nurses to over $200,000 a year for high-risk surgeons. So, I mean, either way, she's gonna be taken care of if they, or the patient will be taken care of if it does end up being malpractice because she has insurance. Hopefully, she has insurance. Yeah. So